right, let's get started. My name is Jennifer Dirksen, and I am the manager of Occupational Health and Safety at Safe Care, and I will be your host today. Let's start today's webinar by presenting our mission and values. We empower workplaces that provide care to create a culture of safety through evidence-based education, advocacy for safer workplaces, leadership, and collaboration. Let's start today by recognizing that we're gathered on the ancestral and unceded territory of First Nations, Inuit, and Métis people across British Columbia. We thank them for being good caretakers of the land and allowing us to be visitors on this shared territory to do good work. Before I introduce the speaker, let's cover a few housekeeping topics. Okay, the webinar is being recorded today. After the event, we will share a link to the recording, the slides, and any additional resources. I encourage you to revisit the content and share it with your colleagues. To minimize distractions, we have disabled the attendee cameras and microphones, so enjoy your lunch, your cup of coffee. We won't see you, but you can still talk to us using the Q&A button at the bottom of the window. So if you type in your question, I'll make sure that I pose the questions as time permits to the speakers. And if on the off chance there's lots of questions and we don't get to them, then I'll make sure that we report back out on some of the answers with the recordings. So in this webinar, you'll be hearing from Daryl Davidson, who is an industry and program specialist with the Prevention Programs and Services Department at WorkSafe BC. She works with industry health and safety associations like us, employers, workers in the healthcare sector to support and advance the prevention of workplace injuries and illness through partnership, collaboration, and outreach. She joined WorkSafe in early 2022 after having spent the previous 15 years working in forestry as a safety manager and healthcare, acting as the violence prevention lead for Northern Health. Daryl will be speaking with us today about the new first aid requirements that came into effect November 1st. So this session has been designed to help you understand and implement the necessary changes. And I'm going to pass this over to Daryl right now.
Thank you very much, Jen, for the great introduction. And good morning, everybody. I'm just going to start my slideshow and make sure that you can see it. How does that look, Jen? Oh, I guess I better share first. Sorry, I started it and didn't share to anybody.
Looks great. We're just seeing the full version right now. Yeah, that's perfect, Daryl. Thanks.
Excellent, excellent. Okay, and welcome everyone. So just wanting to acknowledge as well, thank you for the great land acknowledgement, Jen, but just wanted to acknowledge that I am speaking to you from Prince George, which is the traditional and ancestral and unceded territory of the Lheidli Nation. Yes, I'm very privileged to be joining you and working and playing from that land. Okay, on November the 1st, 2024, as many of you should already be aware, changes to first aid requirements came into effect. The amendments were approved by WorkSafe BC Board of Directors in April 2023, and so began an 18-month-long time lag in implementation designed to allow employers and training providers to prepare for the changes. So the amendments apply to all workplaces and industries, but some of the key changes are especially relevant to those sectors that have remote and less accessible work locations. And there should be few of the work locations for employers such as yourselves that would be remote or less accessible, but there's always the chance that there is. So we do provide that information within the slides. There will just be some slides that I don't go into as great a detail because they are more appropriate to those people that have the more remote and less accessible. Okay, so I'm just going to quickly review the agenda with you. So we're going to be talking a little bit about the rationale and key amendments. We'll talk a little bit about workplace class factors, first aid assessments, first aid procedures, training and equipment requirements, and implementation timeline and key considerations summary. And then we'll have some time for questions after that. Okay, so the requirements for first aid are outlined in Part 3 of the Occupational Health and Safety Regulation. These provisions have seen very few updates over the last 20 years, which has prompted the current overhaul. Now, there were several considerations that formed the backdrop for the review. Firstly, there was an identified need to strengthen the requirements in Schedule 3A, which outlines the minimum levels of first aid, and also to create a requirement for conducting a more robust first aid assessment. It had become apparent that employers often struggled with the first aid assessment and very often defaulted to the minimum levels of first aid listed in Schedule 3A without considering any additional needs or conditions at a particular workplace. The new regulation aims to address this by requiring a written first aid assessment that consists of 2 mandatory elements, including a provision to consider any additional materials and services not already contemplated under the minimum levels in the schedule. And we'll speak about that later. So additionally, over the years, numerous incidents and investigations demonstrated gaps and deficiencies related to first aid services and appropriate emergency transport for injured workers in remote areas and in workplaces with various conditions that created barriers to delivery of first aid. The amended regulation will attempt to address those issues. And finally, the changes harmonizing first aid training and first aid kit requirements with the national standard under CSA, which is the Canadian Standards Association. Harmonizing with the CSA standards is intended to help with labor mobility, allowing qualified workers coming to BC from other provinces to use their existing first aid certifications that they may have obtained elsewhere. Okay, so the key regulatory amendments that have been made to occupational first aid requirements are so the introduction of workplace class, which includes consideration of location and accessibility of the workplace. And we'll go into more detail and in a later slide as to what remote work location and less accessible framework looks like. So written first aid assessments must be conducted in consultation with your Joint Health and Safety Committee or Worker Health and Safety representative. Drills to test the effectiveness of your first aid procedures are required to be conducted at least 1 time per year. Changes have been made to first aid kit requirements to align with CSA 7 or CSA Z 1220-17, and changes to first aid room equipment, dressing station equipment, and emergency transport vehicle equipment requirements are relatively minor. First aid training and certification standards have changed to align with that CSA standard. And the CSA standard that they will be aligning with is Z12010-17. I'll provide more information on these changes a little bit later in the presentation as well. Okay, so in the next few slides, we'll talk a little bit about workplace class factors in determining occupational first aid requirements. Okay, so under the amended regulation, a workplace that is further than 30 minutes travel time by an ambulance under normal travel conditions will be classified as a remote workplace. So a workplace that cannot be reached by an ambulance traveling by land, or a workplace where EHS ambulance attendants cannot safely access will be classified as a less accessible workplace. So normal travel conditions should be determined by the average time it takes to drive to and from the nearest ambulance station, to or from the nearest ambulance station by a motor vehicle, following the rules of the road, so not speeding, and stopping at all, listening to all road signs or making sure that you're complying with them during the normal working hours of the employer's workplace. There are many factors that will make a workplace less accessible and include things like rough or steep terrain or places where an injured worker would be carried for a significant distance. For example, backcountry areas only accessible by ATV, snowmobile, or similar. Again, given those criteria, there should be none, if not just very few, potentially of your workplaces that might fall under that less accessible. Okay, so in the language of the new regulation, most workplaces operated by employers in the 2 CUs that Safe Care BC members fall under, which is CU 766006, Community Health Support Services, and CU 766011, long-term care. They will fall under Class 1, which is workplaces other than a Class 2, 3, or 4 workplace. So basically, that's thinking about those urban work locations without significant barriers to accessing. So Class 2 would refer to a workplace that is a remote workplace, but not a less accessible workplace. So workplaces operated by employers in one of the two CUs above are not that are greater than 30-minute surface travel time from the nearest BC EHS location may be considered as a Class 2. Class 3 would refer to workplaces or to a workplace that is a less accessible workplace, but not a remote workplace. So keep in mind, Class 2 is for remote, Class 3 is not remote, but is less accessible. So Class 4 would refer to a workplace that is both a remote workplace and a less accessible workplace. So it fits both of those criteria. So how a workplace is classified is significant because workplace classifications will determine how many first aid attendants are required at a particular operation and what level of certification they must have. So the minimum requirements based on industry hazard rating and workplace class are outlined in Schedule 3A, minimum level of first aid. And as previously mentioned, the schedule is changing with the amendments to strengthen the requirements and to reflect changes to the first aid training requirements, including training course duration at the intermediate level. So it does now look different than you will have seen it in the past. So each workplace should be or would be required to determine for themselves what class they would fall under. And if employers aren't sure, you can reach out to your WorkSafe BC occupational safety officer or occupational health officer. If you don't have their contact information, you can reach them through the WorkSafe BC prevention information line. Then you can get that just by going to our website and going to the contact us page. So it's really easy to get in contact with them just by reaching out to that line. Okay, so over the next few slides now, we're going to talk a little bit about the requirements related to first aid assessments. Okay, so section 3.16 of the new OHS regulation states that an employer must provide for each workplace at least the equipment, supplies, facilities, first aid attendants, and services required by Schedule 3A, and any additional equipment, supplies, facilities, first aid attendants, and services that are necessary to ensure that workers who suffer an injury at work can be promptly provided first aid and promptly transported for medical treatment. So this sets the stage for a two-part duty that the employers will have when conducting a risk assessment. It requires the employer to determine the minimum level of first aid based on the employer's hazard rating, location, and nature of the workplace, in addition to the number of workers at that workplace. It also obliges the employer to consider any unique workplace-specific attributes that may impact the provision of first aid services. One such attribute would be whether the first aid attendant is able to promptly leave the task they are currently doing to provide first aid to the injured worker. So when they say promptly, they mean within 3 to 5 minutes. They're able to be ready to either receive that injured worker or to be able to go to where that injured worker is. As we'll see shortly, consideration of both parts must be done in consultation with the Joint Committee or Worker Health and Safety Representative, and it must be documented in a written first aid assessment. We'll talk a little bit more in a later slide about what that consultation looks like. Okay, so minimum first aid services are determined by assessing 3 factors. So the hazard rating, the class of the workplace, we talked about class 1, 2, 3, or 4, which includes consideration of both the remoteness and the accessibility of the workplace. And also that third piece, the number of workers present at the workplace. So a relative hazard rating is assigned by WorkSafe BC. Just give me 2 seconds, sorry, to each industry classification unit based on claims statistics and knowledge of common risks and hazards typically associated with workplaces assigned to a given classification unit. So hazard ratings assigned by WorkSafe BC can be found from the classification unit description sent to employers with their assessments rates letter each year. That comes out in November. So you should be receiving that or have already received that this year. And hazard ratings can also be accessed on accessed on worksafepc.com, and just look for a page titled Find Your Classification Unit, Industry, or Rate. So based on the nature and extent of the risks and hazards in the two classification units, 766011, long-term care, and 766006, community health support services, employers in these classification units are assigned a low hazard rating for the purposes of determining minimum first aid related requirements. So typical work activities conducted by workers at workplaces that fall under these two CUs would fall under the same relative low hazard rating for the purposes of determining minimum first aid related requirements. This would also apply to workers contracted to conduct these same typical work activities. So an example would be a long-term care home may have all workers at the site employed under one employer, or they may have contracted certain typical work activities, housekeeping, laundry, food services, etc., to one or more external service providers. Those typical work activities wouldn't change, just who the worker is paid by their employer. So they would still fall under, as a minimum requirement, that low hazard rating as well. And again, it must be noted that the hazard rating assigned by WorkSafe should be considered only the minimum acceptable hazard rating. So you can't go anywhere below that. But by all means, your assessment should identify where there's potential that it potentially should be above. Yeah, so there are some exceptions where there are separate administrative locations. For example, for some of you guys, it could be that you have multiple locations, all under one employer, and you have administrative offices that service all of those sites. So the criteria of being a separate workplace and where the substantive hazards of the industry are not present, such as administrative office, in those situations, those offices may be considered a low hazard workplace for the purposes of determining minimum first aid requirements. But again, because it is a separate location, it would have to have its own assessment done. So for multi-employer workplaces, the prime contractor is required to conduct an assessment of the circumstances of the workplace under section 3.162 in relation to all workers in the workplace. So whether they're paid by the employer or not paid by the employer, they must consider those. So keeping that in mind, an employer may also choose to capture in their written contract with the external contractor whether the employer that operates the workplace or the contractor has responsibility providing first aid services to those contracted workers. So keep in mind as well that even if the written contract between the employer and the contractor identifies that the contractor is responsible for providing first aid to their own workers, the employer, as prime contractor, would still be required to confirm an appropriate minimum level of first aid services has been provided for those contract workers conducting work activities while at the employer's workplace. So that includes confirming that the first aid attendant has the appropriate certification and qualifications. Okay, so in addition to determining the minimum requirements for first aid, employers must also consider the unique circumstances of the workplace to verify that the minimum requirements are sufficient to meet the regulatory requirement of ensuring injured workers can be promptly provided first aid and transported to medical treatment. The following additional factors must be considered as part of the employer's first aid assessment: nature and extent of risk and hazards in the workplace, and the types of injuries likely to occur. So employers are expected to enhance the minimum requirements. This is where you're going to go above for first aid services set out by Schedule 3A based on specific hazards and risks present at the employer's workplace. So information about identifying hazards in the workplace can be found on worksafebc.com, just simply by typing the phrase in to the bar at the top, search bar, identifying hazards. So employers must consider enhancing first aid services where there are hazards present that are unique to the workplace, its workers, or there are hazards not typical of the employer's classification unit. I think for most cases, this isn't going to apply to your workplaces that employers such as yourself operate, but you do need to make sure that there isn't something different, unique about your workplace that may be different from the typical workplace that falls under those two CUs, and consider those when you look at whether you need to enhance those procedures or those services you're providing. So employers are also expected to consider the types of injuries that may reasonably be expected at the workplace. So information on the types of injuries that have previously occurred at your workplace or similar workplaces can be found in, your past first aid records, incident reports, and claims histories. You can find them also from industry health and safety associations such as SafeCare. They'll be able to access, or you'll be able to access that information through them. And then WorkSafe BC statistics, and then on the internet and other research that you can do will also net you that same information that you might be looking for. Okay, so to emphasize once again, this important requirement, in addition to determining the minimum requirement for first aid, employers must also consider the unique circumstances of the workplace to verify that the minimum requirements are sufficient to meet the regulatory requirements of ensuring that injured workers can be promptly provided first aid and transported to medical treatment. Consider whether additional first aid services or supplies, just a few examples, definitely not limiting, is eye wash stations and burn dressings may be required to treat injuries related to specific tasks that workers may conduct at the workplace. So you need to consider those things and think about bumping up what services, including equipment, that you may have. Schedule 3A lists only the minimum levels of first aid, and it is only meant to be a starting point for employers assessing what they will actually need to have in place depending on the hazards and conditions specific to their operation. So this is where your assessment really comes into play. It's going to help you to determine, do we meet the requirements and can follow Schedule 3A as it's listed? In some cases, based on the risk assessment, these minimum levels from the schedule may be adequate, but in other situations, additional first aid attendants and maybe a higher level of certification may be required to properly respond to first aid emergencies. So a requirement to conduct a formal risk assessment has existed before. That was always there. But with the new requirements, this assessment will need to be written down and available for inspection. The written assessment must document both the minimum first aid services as per Schedule 3A and any additional equipment, supplies, first aid attendants, and other services that are necessary to ensure that injured workers can have prompt access to first aid and prompt transport to medical treatment. Extensive guidance on conducting a risk assessment and determining additional first aid service requirements can be found in the guideline posted on worksafebc.com. And what I'm going to quickly do, just because I've been finding that this is something that people find useful, I'm actually going to show you how to really easily access those. Okay, so Jen, can you let me know if you can see that? Excellent. Okay, so this is our front page of worksafebc.com. So if you go down to these tabs that are closer to the bottom of this page, and you just click on health and safety, and then click again on one of these blue tabs you'll see in the middle, search the OH regulation and related materials, and then you can search if you want to look at the Workers' Compensation Act, OHS regulations, policies, guidelines, standards, and other legislation. So in this case, you can either choose the regulation or the guidelines, and then you can actually just drop down with the drop-down menu will help you choose where to go. And in this case, you're looking for Part 3, rights and responsibilities. And then you're going to want to scroll down a little bit and follow down to where it says occupational first aid. And all of the guidelines, including the one on first aid assessments, is listed in here. So you can just click on that link, take you right to the regulate or the guideline, and you can get some guidance on that. And again, if you're not sure, reach out to your officer. They will help you. And SafeCare BC can provide that information as well. Jen is really well versed in these processes, so she'll be able to guide you where to get the answers that you need if she's not able to answer those questions herself. Okay, I'm going to move that back out of here. Okay. Let's go on to the next slide. Sorry, guys, it just needed me to flip back to because I moved my mouse. There it is. Okay. So section 3.163 requires, I should say section 3.16 subsection 3 requires first aid assessments to be reviewed and updated every 12 months or whenever a significant change affecting the assessment can occur. So keep in mind that annually and every 12 months means slightly different things. So annually means at some point each calendar year, so in 2024, sometime in 2025, etc. And every 12 months means that within a 12 months period from the previous review, another one, that's the outside time that another one is required to occur. So if you did your last one in December, you have to have completed another one. Say it was done in December of 2024, you have to do another one by December of 2025. So significant changes in the employer's operations that would require an employer to review and update the first aid assessment include changes to the maximum number of workers present at the workplace, the class of the workplace changes, so accessibility or remoteness changes. So the nature and extent of risks and hazards in the workplace changes through the introduction of new or different equipment, processes, tasks, or workplace conditions. And WorkSafe BC updates the hazard rating assigned to the employer's classification unit. If suddenly your classification unit goes from low to moderate, then you will need to redo or review your assessment and make sure that that you have accounted for that increase in hazard level. When changes to barriers or routes are identified, and that may affect first aid or transportation response or BC EHS response or travel time. So think about that if all of a sudden you're notified that the BC EHS station that was closest to you before has now closed down either for a significant period of time or permanently, you're going to need to source out another one and then look again at that. You know, are you within 30 minutes surface travel time from that station? So employers should document the date of when a first aid assessment was reviewed and who was involved in the review process. So compliance with the requirements of this section can be verified. If changes are required following the review, a new assessment document should be completed in consultation with workers. And again, we'll talk a little bit more later about what that looks like. Okay. So it's important to reemphasize that the assessment must not result in a level of first aid services lower than the mandatory minimums required by Schedule 3A, except as provided in the first aid guideline for separate administrative office locations. And in the case of phased work at multi-employer work locations, this typically isn't going to apply to your workplaces. That really applies more to if you had for example, at your workplace, if you had a very major construction project happening, then that might come into play, but more often than not, that becomes a construction work site. And then they would be, the people working at that would be making sure that they have the first aid, appropriate first aid services for that. And once again, conditions for these exceptions are outlined in the guideline. So to assist and guide employers through the assessment process, a great template or tool called First Aid Assessment Worksheet is available in a fillable PDF format on WorkSafe BC's website. So you'll see in this slide what it looks like. So it's really easy to find. I've also linked that at the end of this presentation, so you guys will be able to see that and access it if you'd need to or like to. Okay, so over the next several slides, we're going to talk about developing and implementing first aid procedures for your workplace. Okay, the bolded subsection C1 that speaks about barriers to first aid is new as of November 1st, 2024. So written procedures should include the names of first aid attendants and their first aid certification level, so where practicable, as well as a description of first aid equipment and supplies available at the work site. So you're basically saying we've got an intermediate level first aid kit, and we have 2 or 1 intermediate first aid attendant. Procedures should instruct workers on how to obtain first aid for both minor injuries and serious injuries, and they should include instructions on the expected response to first aid attendants when it may be necessary to either transport the injured worker or request emergency services. The location of first aid equipment and supplies must also be included in the procedures, and one may consider including a map to provide a visual reference, which makes it easier for people to find out where they may access first aid in an emergency situation when somebody has been injured. All of our are the things that we would normally keep in our mind can go out of our minds. So having something that is very visual as to where to go can certainly help with that, especially with more complex work sites where it can be more difficult to find your way around. So as in, in many workplaces, first aid attendants perform other tasks in addition to their duties as first aid attendants. If any procedures are required to enable the first aid attendant to leave their assigned duties, those should be included in the procedure as well. As in the risk assessment, any potential barriers to first aid will need to be identified along with solutions, and those solutions must be outlined in the procedures, and this is a new provision. So where the workplace or areas of the workplace are not accessible to BCEHS attendants, the procedure should detail equipment and personnel required to access and move an injured worker to an accessible location. Again, I think that this is going to be very rare, if at all, that this applies to your work sites. But less accessible workplaces, I'll just quickly say, that have developed separate rescue procedures for less accessible areas, the procedure should reference those rescue procedures. And this is not required if all of the areas at the workplace are accessible to BCEHS, which is likely to be all of the locations at your workplace. Okay, so 3.17 continues here, stating that the written procedures for first aid must include a statement about the authority of the first aid attendant over the treatment of injured workers and the responsibility of the employer to report injuries to the board. Who is to call for transportation for the injured worker and the methods of transportation and calling. If emergency transportation is required by Section 3 of Schedule 3A, the location of the method of transportation, emergency transportation, and any prearranged routes in and out of the workplace and to medical treatment. Okay, so in the case of remote workplaces where BCEHS ambulance services may be significantly delayed, or where the nearest medical facility available to treat workers is more than 2 hours away from the workplace, employers should consider providing alternate or supplementary methods of emergency transport for seriously injured workers. Known or foreseeable emergency room closures and other geographic and access locations should also be taken into consideration, along with hospital bypass protocols. Now, you notice it says known or foreseeable. So if you don't know that, it pops up in the morning that that emergency room in your community has closed down, that is not something that you will have been expected to know. And those short-term closures happen in different communities around the province. It's really looking at those known or foreseeable emergency room closures, the ones where we already know it might be closed for an extended period of time, or they give you notice well in advance that on these certain days they will be closed. This may mean employers provide and maintain a vehicle meeting the requirements of Schedule A, Section 6, 3-A, Section 6, which deals with emergency transportation, or they need to arrange for the availability of emergency air transportation. Okay, so if emergency transportation is required by Section 3 of Schedule 3A, more information is provided in this slide related to vehicle requirements. I'm not going to go into great detail on this, due just simply to the small number of workplaces that this would apply to, but it will be in the slide will stay here, so you'll be able to reference it because you will get access to this slideshow following the presentation. It is important for all workers to understand the first aid procedures and be able to easily access these procedures for reference in the event of an injury causing incident. So where practical, first aid procedures should be printed and posted throughout the workplace, including lunchrooms and other areas where workers congregate, common places on your health and safety board. Procedures can be made available on an internet or shared drive, though it is important that all workers have easy access to this information, that they can very quickly access it, that they don't have to go to, an instruction page to show them how to access it. And then on temporary work sites or where workers work away from the head office, posting the procedures may not be effective. And then other methods, including cell phones, use of cell phones, QR codes, mobile apps, etc., should be included in that communication process. So printed copies can be provided in vehicles, and in that case, a confirmation of procedure documents would be included on vehicle checklists and their availability verified through inspection. So when you're doing your inspections on your vehicles, you can confirm that it's there. Naturally, copies of first aid procedures should be added to first aid kits, just because, hey, it just makes it really accessible even for the first aid attendant in case there's something they need to check out to help guide them. Employers need to ensure that workers are trained how to find first aid procedures, and this can be verified as part of a drill or a workplace inspection. So making sure that they know, your workers know how to access this information is really, really critical when an emergency arises. They should also involve workers in the selection of communication methods that will work best for your workforce, and a combination of methods may be needed to ensure that procedures are effectively communicated and can be easily accessed by workers, especially in a moment of stress. As I mentioned before, it's amazing how quickly one forgets that at the beginning of phone books is how to access ambulance in areas that don't have 911. Some people just forget even that they can call 911. Okay, let's give me a sec here because I think there it is. Thank you. So drills for first aid provide the employer and workers with an opportunity to test the effectiveness of first aid procedures. Through drills, workplace parties gain a deeper understanding of their roles and responsibilities, promoting a swift and effective response in the event of a real emergency. Drills also provide an opportunity to identify and resolve potential challenges or shortcomings in the employer's written first aid procedures. So procedures and processes should be assessed during the drills would be the ability to access equipment, supplies, and facilities, workers' familiarity with how to call for first aid and the location of first aid equipment, how effectively the first aid attendant can be summoned, how effectively the first aid attendant is able to respond, how effectively an injured worker can be accessed and moved, and then any barriers that might affect that, how effectively an injured worker can be prepared or packaged and transported to an area accessible by BCEHS, and whether first aid attendants are familiar with documentation and reporting requirements. First aid drills should include mock scenarios that support the evaluation of the effectiveness of the procedures, and you actually can do a first aid drill in at the same time as you're doing a drill for something else. You can do, for example, a fire drill and a first aid drill, in conjunction, as long as neither one impacts on the effectiveness of the other. You would just need to make sure that you are meeting the requirements of both types of drills per the regulation. So activating a workplace emergency response plan, including first aid in response to an actual incident, is not considered a drill. So just calling and activating that plan is not a drill for the purpose of complying with the regulation. There's still, employers still required to hold a formal drill. So the results of the drill and any subsequent changes to first aid procedures, any gaps that were identified, should be shared with all first aid attendants, as well as the Joint Health and Safety Committee or Worker Health and Safety representative, as applicable for your worksite. Okay, drills should be conducted as soon as practicable following the implementation of procedures, so at least annually, and when procedures change. So drills must also be conducted when there are substantive changes to written first aid procedures, and a substantive change might look like one of these items here that are bulleted. So transportation, change in protocol, change in the workplace class, level of first aid required, certification required, and maybe a change to the rescue procedures. And further guidance on when drills should be conducted based on the characteristics of the workplace or number of workers are outlined in the guideline. So employers may consider maintaining drill records to establish compliance with the requirements of 3.17 subsection 4. That means an officer may want to look at it. So you need to be able to prove that you've done a drill. Okay, employers must use air transport as a primary transportation method for a seriously injured worker if air transport is the only reasonable means of access to that work location. So as I mentioned in regard to some of the previous transportation specific slides, I'm not going to go into great detail as it doesn't apply to many of the workplaces that you guys operate, but the information is here if you want to read it. Oh, looks like I have two versions of that. I apologize. When we give you the PDF, we'll make sure that the correct version is in there. Okay, so the next section of the presentation, we're going to talk a little bit about new training and equipment requirements. Okay, so in alignment with CSA Z1210, will affect both the naming conventions and course duration of first aid programs while enhancing first aid requirements for program quality control. So for occupational first aid training in BC, previously, a level 1, level 2, or level 3 first aid certificate that is valid and had an expiration date after November 1st was all you needed. Now, if you have an expiry date for a level 1, 2, or 3 that is after November 1st, 2024, that expiry date will still be upheld, and that certification will be considered basic for your level 1, intermediate for your level 2, or advanced for your level 3 until the date of expiry. So once that certificate, previous certificate expires, you will then be needed to get training in the new basic, intermediate, and advanced first aid. So some small changes. Basic first aid is still 1 day, just like OFA level 1 was. Intermediate first aid has gone from 5 days down to 2 days, and the advanced first aid has stayed the same as the old OFA 3 at 10 days. Transportation endorsement is still 1 day, and it is still a requirement. So WorkSafe BC has authorized certain agencies throughout BC to teach occupational first aid training programs acceptable to WorkSafe BC and certify attendants who successfully complete the program. And a list of approved first aid training providers can be found on our first aid attendant certification page, and I've linked one in this the end of this presentation as well. Okay, so first aid kit requirements are changing or have changed to align with CSA Z1220-17. And a summary of those changes is defined within this table. And then a detailed list of contents that must be in each type of kit are contained in the first aid guideline on worksafebc.com. And there's actually a resource that will show you all of them as well. So there's a whole, I think it's a 10-page resource that goes into great detail on it. And employers are expected to move to these new contents as new kits are purchased or supplies are replaced. So your existing kits should be supplemented with any significantly different components required in the equivalent CSA assigned kit or aligned kit. However, there's no expectation for employers to dispose of existing first aid supplies that are the same. So if it's the same in the old kits, same in the CSA aligned, you can keep that same supply. And then changes to the emergency transport vehicle equipment and first aid room equipment, dressing station equipment are minor and will reflect changes to terminology and the inclusion of some the new materials into the first aid kits. For example, the number of splints required in a first aid room will decrease because they're now included in CSA kits. Okay, substantive changes have been made to the OHS guidelines related to nurses acting as first aid attendants in healthcare facilities. Now that formerly that guideline was called G3.15 subsection B-1. So the revised guideline outlines the following requirements. So remember that we're looking at nurses, registered nurses, or registered psychiatric nurses as first aid attendants in healthcare facilities in general. So that's all healthcare facilities. WorkSafe BC approved first aid training providers may issue an intermediate first aid certificate to a registered nurse or registered psychiatric nurse on receipt of a written request from an employer offering healthcare services confirming that The individual is currently employed primarily as a practicing nurse and holds a valid license issued by the BC College of Nurses and Midwives. The nurse has reviewed and completed the WorkSafe BC jurisprudence package. That's included, a link to that is included in here, or have received other equivalent training. And the nurse has successfully completed a basic life support course within the last 3 years. The intermediate first aid certificates that are issued in this way are not transferable to other industries, but they are transferable to other healthcare facilities, just not other industries outside of healthcare. Okay, so I'm going to talk just really quickly about the other guideline that was added, and that is G3.15-2, and that outlines the requirements for license recognition for registered nurses and registered psychiatric nurses working in healthcare locations operated by a regional health authority or by Providence Health Care in any one of only 3 healthcare CUs. That's 766-01001, which is acute care, 766-011, which is long-term care, and 766-019, which is short-term care. The nurse would still have the same requirements to meet as they would if they were a nurse in any healthcare workplace for the purposes of acting as an intermediate level occupational first aid attendant at their workplace. The main difference between the previous guideline that we talked about and this one is that a nurse in a healthcare workplace may have their intermediate level occupational first aid equivalency certificate granted by an approved external training provider, while a nurse in an applicable health authority operated workplace may be provided recognition to act as an intermediate level occupational first aid attendant by their employer, which would have to be Regional Health Authority or Providence Health. It should also be noted that that recognition that we talked about in that second guideline discussed is non-transferable to other healthcare locations operated by employers other than the regional health authorities or Providence Healthcare, or in other classification units. So that recognition only applies in those 3 classification units. Applicable classifications, we already talked about those 3. So another quick note that I wanted to talk about, just because this question did come up with some of you guys, is that the OHS regulation does not identify where funding comes from for the services an employer provides as a consideration when determining whether a healthcare industry workplace is operated by a health authority or Providence Healthcare or a non-health authority employer. It looks at which employer operates the workplace location itself. And if an employer needs additional help related to this and determining, because it can be quite complex, please reach out to your officer and have that conversation with them. They are probably intimately familiar with your workplace and can help guide you along that line. And if they can't, they're going to pass you on to who can. Okay, so the revised guideline, the first one, G3.15-1, and this is, again, nurses acting as first aid attendants in healthcare facilities in general. It also states that nurses are obligated by the professional standard of their license to function only within their level of competence. Employers that wish to utilize registered nurses as first aid attendants under this provision must ensure first that the nurse is willing to act in that capacity of a first aid attendant, confirms that they have been trained in the knowledge and skills associated with intermediate first aid attendants, has operational capacity to fulfill the duties required by Section 3.21 of the regulation. These same requirements also are for health authority and nurses that may be granted recognition. So to sum up a few key considerations related to the new occupational first aid requirements. So first aid certificates remain valid until expiration. Retraining is not required unless the attendance certificate is expired. First aid kits do not need to be replaced, simply replenished or additional materials added in accordance with CSA kit requirements. Written first aid assessments are required annually. Revised OHS regulations for Part 3, occupational first aid, are posted. And new and revised guidelines for the same are also posted on WorkSafe BC.com. Okay, so I have added to the slide several resources, several resources to support the changes in the regulations. And all of them can be found under the resources section of our first aid requirements webpage. And I've even provided a link for that resources section for you. So it'll be very easy to find where those are. And one link that I wanted to include in this slide, but I see that I don't have in here, is that resource I was telling you about that is titled First Aid Equipment, Supplies, and Facilities. And again, that's a great other resource that is new and tells you everything that needs to be in those different kits. Okay, so I'm going to pass this back over to Jen.
Thanks, Daryl. So much good information. Thank you so much. And there's been a bunch of questions that have come in through the chat, so I'll just move on to that in a second. Let me just go back and share my original screen here. All right, so one of the questions was, are LPNs eligible for the under the guidelines for the nurses? Can't think of what that's technically called, for the jurisprudence package allowance.
And they are not. It is registered nurses or registered psychiatric nurses. Those are the only two. Physicians aren't either anymore, where previously they were.
Yes, good point. Thank you. Somebody else had said, well, we're a group home. They hadn't given a lot of context, but it was also during the time where you were describing nurses and their functions and the first aid requirements or the equivalency for that. So it's a slightly, I don't know what the full question is there, but
so if your employer, or sorry, your site falls under one of those two CUs, 766-011 or 766-066, sorry, stumbling over my words. One of those two CUs, then an RN or an RPN that works within those sites would be able to. And again, keep in mind there's two different guidelines depending on whether it is a site that is operated by a regional health authority or Providence Healthcare or a non-health authority operated workplace. Because hopefully that answers the question.
I think so. Maybe the person who posted it could enlarge the question a little bit more if you wanted me to ask it in a different way. But I'll move on to the other questions for now, if that's okay. So Shima says, I have a question about the maximum number of employees at a work site. Is it the number of employees on a regular day at any given time? If so, is it a maximum number of, they normally have a maximum number of 3 on shift, but sometimes during meetings, they'll have 9 workers present on shift.
So there's a whole bunch of guidance provided in the guidelines about all of those, because there's so many different workplaces that have a variety of when, times that their workers are on shift, as well as some of them have transient workers, workers that are dispatched, as well as they have different shifts, right? Some of them have a day, a night, an afternoon shift. So there is a lot of guidance, but typically guidance within that guideline, I would recommend you go there because I'm not going to be able to verbatim be able to cite all of that information. But typically what they're looking for is in that particular shift at that time that you're doing the assessment for, they're looking at what are the workers that are present at some point in that day. So if you do define it as different shifts, like half of the day is shift this, half of the day is shift this, you can do separate assessments and you can identify separately if you need different first aid attendants in there. But what would not be effective would be to have, like, say in an 8-hour shift, having every 2 hours be a different first aid attendant because you might have different people. That I've just never seen that happen. And it just is, it would be something that it would be kind of hard to justify how effective that would be and safe that would be for injured workers needing to access first aid. Communicating that would be a nightmare. So typically in a day, in that given shift, how many workers maximum will be on shift? Remembering that there is a allowance for workers that are only there for really short periods of time, such as delivery folks, and the guideline gives lots of information.
Awesome. Thanks, Daryl. That's really good context. Tom asked a question. He was asking just if the WorkSafe website has simple guidelines that can be followed on the new regulations. And I'm going to hand it over to you, but first I'm going to say I really like just the general first aid page that's there. There's actually quite a lot of documents. If you just Google first aid WorkSafe, it comes up with the first magical page that has tons of information. But of course, Daryl, I'll leave it to you to answer.
Yeah, so as I've mentioned, we do have same thing. If you go actually right now, because these regulations are new, and so this is going to stay for a little while. I can't tell you how long it'll be there, but if you go on to worksafebc.com on our main page, you're going to see a link to get more information on the first aid, the new first aid requirements. And in this presentation that you guys will get a copy of, PDF copy of, you'll see links to a lot of the resources that I've teased out. I think there's something like 10 or 12 of them on there. But at any point, you can go to the WorkSafe BC front page and just type in first aid, and it's going to take you to, a couple of different web pages that we have to deal with, certification for first aid attendants, first aid requirements, all kinds of different things you'll get information on. And then if you're really not sure, reach out to Jen, because Jen will be able to help you and guide you there.
Awesome. Yeah, thanks, Daryl. A couple questions that were actually sent in to us beforehand, so I'll just quickly get to them before we run out of time. It says, what level of involvement is required for a JOSH committee, or of course a worker representative, in the first aid assessment process? The writer said, because it just says consultation.
Yeah, exactly. So think about consultation as not just doing your assessment and then handing it to the joint committee to do a quick review and give back to you with their okay. The idea is, like with any time we talk about consultation with workers or consultation with joint committees, we're talking about through the process. So as you're determining the different requirements within the assessment, to determine what first aid services you need, make sure that you're reaching out to your joint committee to get their feedback on what that might look like. It could be that you do an initial, as an employer, you do an initial run at the assessment, and then you bring in, you could, I'm not saying this is the way to do it, just saying potential. You could then bring that to the committee and say, hey, this is what I've, initially thought of, but I definitely want your feedback on what this might look like. And let's have a discussion about that. If you see anything that you think maybe could be different. What we see too often is, like I said, the employer might do it and then hand it over and say, please just sign it off. I need it right away. And the expectation is they just give it back. No, there should be that consultation. Now, there isn't anything that defines, step by step, each of the different pieces that the joint committee must be consulted on. But at different parts in the guideline and the regulation, it says, and this must be done in consultation with the workers at the site. This must be done in consultation with. And then keep in mind that if you don't have a joint committee and you don't have a worker health and safety representative requirement, you are still required to bring workers into that consultation. So if you have that, less than 9 workers at your workplace, just, pick some workers that would have knowledge of that, would be able to give you some good guidance, and then include them in that assessment consultation.
Yeah,
Hopefully
really good
that answered it.
information, Daryl. Some of our members would have quite small care homes, and it's good to remember that we always want to have the voice of the workers in everything that we do in health and safety. One last question before we go so that we don't get out of time. Marie posted a question. I don't fully understand it, but I'm going to post it to you anyways. How do we meet confidentiality requirements of medical conditions? Previously, we had to keep the assessment forms in a binder and visible for all to see. Now, I'm confused because the first aid works assessment doesn't contain confidential personal information. So perhaps that's where the confusion is. But if you have anything else to add, Daryl, we'll quickly throw it in now.
Yeah, I think I may be wrong, but I'm thinking she's talking about first aid records. Now, the first aid records are meant to be kept confidential as well, which means that those need to be kept secured in a way that they are not easily accessed by anybody except by those people that need to have that information. So typically in a first aid room, or wherever you guys might store your first aid records, that would be in a locked cabinet or drawer, and not everybody would have the key to that, because yes, there is personal information. So following the same confidentiality rules, keeping in mind that some things that will affect the first aid that is provided, by the attendant may need to be known to be able to provide proper first aid services. But only that information that needs to be there should be there as well. So again, follows all confidentiality requirements.
Fantastic. Thank you, Daryl. Thank you for all the knowledge and the resources and the support. I learned something. I hope everybody learned something. Before I let everybody go, I just want to share another page that shows our upcoming events. We have so many good things on the go. Certainly, I'm partial to the OHS Committee Part 2. If you want to see more of my face, then I'm the one who's delivering that. So I look forward to seeing everybody there and in our next webinar. So thank you very much for joining us. Have a great day.
Thanks, everyone.